Hi, my name is Jane Powell. Welcome to Community Connections, brought to you by the Greater Kanawha Valley Foundation. This is a show showcasing community involvement. Today we are going to learn about a new clinic that is opening and its long-standing history. So I'm excited to introduce you to my guest, Jake VanHorn. Welcome to the show.
Thank you, Jane. I'm very happy to be here.
So Jake, you are the right person to be talking to today because you have a doctorate in clinical psychology. You are also the Community Impact Officer for Cabin Creek Health Systems.
I am. That's
so
what they call me.
That's a lot.
It is. It
And
can
you
be.
do a lot. You and your health system do a lot.
Mm-hmm.
So let's just give me the big overview. Tell me about Cabin Creek.
So Cabin Creek actually has a really kind of an interesting foundational story that has kind of developed and continued to lead our thinking over time. So it was formed by a bunch of coal miners who were unhappy with their healthcare options for them and their family. And they kind of got together and built out a health system that has grown now into a full federally qualified health center, meaning that like we're a safety net provider. So cost of care is never a barrier to care, and we have programs. We take all insurances, and we have programs related to sliding scale fee to make sure people can get affordable health care in their community. We've got 7 outpatient clinics, 7 school-based health centers.
Oh, I just looked this up. And you have a mobile unit?
We do. We have a mobile medical unit which sees primarily unhoused and underhoused folks in Kanawha County.
And pharmacies, and there's addiction recovery programs?
Yeah, so we operate a comprehensive addiction recovery program which utilizes evidence-based treatment models to kind of get folks back on their feet and back into the community where they want to be. We have our pharmacy program is part of what's known as a 340B pharmacy program. It's a federal program which allows us to provide drastically discounted medications to our patients. And we have pharmacies at 4 of our locations. So that would be our Kanawha City location, our Sissonville location, our Clendenin location, our Dawes location, and then very soon it will be at our new site at the Westside Health Center. And so, yeah, we're happy to bring all that. We also have pretty low barrier dental care, lower barrier dental care. Dentals can be kind of challenging, but we
So it is
enjoy
truly
bringing
a
that.
health system.
It is. Everything in one house.
We'll talk about, West Side Clinic is new and it's opening, and I want to get to that in just a moment.
Mm-hmm.
But let's start at the beginning, because I think we know it was created by coal miners.
Yep.
But the building itself has an interesting story.
It does. It does. So it was part of the Yale Architecture and Design School's yearly project. So for an entire year process, Yale went through with the folks that were organizing the clinic and built out a spec building exactly for what they need. And that building still serves the Dawes community and the Cabin Creek community to today.
And that is recorded in Yale literature.
It
I
is.
think we have a picture of that we're showing.
Yeah.
So that
It's
is,
a pretty cool story.
it is. So from that initial thought coal miners needed to create their community and their health care, to Yale stepping in and helping build the building, you've grown to 7 clinics.
Yeah.
And they're all in Kanawha County.
They are, and they all kind of still share that same mission that the first clinic shared, where it's really trying to reflect what the community needs. Mm-hmm. Every community has a different set of needs. The people in that community have different wants, different goals, and so to be a good health provider, you have to be responsive to those things.
Mm-hmm. That's right. So with scattered around the county, but now opening momentarily, if not already, on the west side of Charleston.
Yeah, we saw our first primary care patient Monday. That would be September 23rd, would have been this last Monday.
Great.
Yeah, very excited about that.
Yeah.
And so we're going to be kind of phasing in different programs over the next few months as we A, build volume, and B, get our staff in place. Mm-hmm. So primary care is now accepting appointments. Our addictions program is operating out of that site. Our dental program will be coming shortly, and our behavioral health program. So we have 2 general behavioral health providers. Right now they're psychologists. and they will be providing like depression, anxiety, kind of all the treatments that somebody may need. There's also going to be a psychiatric provider on site, so people can get their psychiatric medications managed as well. And then there'll be a 340B pharmacy as soon as we clear all the inspections and certifications.
So how do I get an appointment there?
Well, the best way to get an appointment there would be just to call.
And it's my understanding that there is not a 1-800 number
No.
for Cabin Creek. I need to call the location that I want to see.
Well, and so that's also kind of based on the fact that we're in so many communities and specific to so many communities.
Right.
So if somebody's living in Sissonville and they really need health care, it's most convenient for them to call the Sissonville Health Center, which is listed on the website. And if they want to attend the Westside Health Center, then that number is also listed on the website. So the website's usually a pretty good place to start and finding the right clinic and the right fit for you.
And so that is cabincreekhealth.com.
Yes, ma'am.
So I go there, I find the clinic I want, I give them a buzz, hey, I make my appointment.
Mm-hmm.
Then I go in, and depending on what service I need, it's pretty much a one-stop shop.
It can be, yeah, for sure. So, and that's especially like if you know, if you're talking through with your primary care doctor, oftentimes whenever I'm meeting with my primary care doctor, I may think about something else that I need. And I think, it's been a while since I've gotten my teeth cleaned. Well, the convenient thing now is that primary care doctor can immediately shift you to an appointment to get your teeth cleaned. So it kind of all flows together and produces these warm handoffs where within one system, within one place, all of your providers are collaborating to provide you the best care possible.
And there's the whole transportation.
Yeah.
Because if you're in my community, chances are I can get there easier.
That is the hope. Yeah, easier. Yeah, and then we do try to support folks in transportation through different services, but transportation is a huge barrier to care, and it's a real negative social driver to health in our area.
Right, but it's a lot easier to get a few blocks or a few miles than across the county to a different location.
Yeah, and speaking specifically about the west side, I mean, we're between two bus lines. We're right on 303 Ohio Avenue, so we're right in the the heart of the west side, or not the heart, but like in the west side.
So I guess if you're west side familiar, you're in the old Kroger's. What I know is the old Kroger's and the old post office.
Yeah, you can really identify when somebody moved or lived on the west side or in Charleston based on which one they use. Yeah.
Oh yeah, because Kroger's was a long time ago.
Yeah, but that's okay. But it lasted a long time too. So.
Right.
Yeah. But it was a Kroger, then it was a post office, and now we're very happy that it's ours, and we're able to provide services for folks.
Yeah, very nice. I've had fun watching it be built, and so I'm hoping to get invited for a tour one of these days.
Anytime.
Yeah. Tell me some of the other exciting things going on.
Well, so we're kind of moving through, we really know how to provide pretty good evidence-based healthcare. There are manuals for that, and there's kind of basic frameworks. Mm-hmm. What we need to learn is like how to provide for a specific community, and we're always open to learning. Mm-hmm. So as we talk through the west side, we're going to be spending time doing some open houses, inviting folks in for tours. We have the website that we're happy to receive feedback and information on, because in order for us to best serve the community, we have to become part of that community.
Absolutely.
And so, and part of that's getting to know our neighbors. We're very happy to kind of be having events and other stuff. So as we push that stuff out, community should feel free to come up. Everybody's always welcome. Mm-hmm. Yeah.
So I'm sure you will hear lots of things you're doing right, and you'll get some constructive feedback as well.
Hopefully.
And yeah, but that's how you learn, and that is what being part of the community is about, right?
Yep, being responsive. So we've got some trash pickups, and so there's a popular programs like you walk with a dock is kind of what sometimes they're called, and the hope is that we're going to be able to kind of also combine that with some community cleanup and revitalization, and maybe kind of sponsor some of our neighbors to come out and work through those programs with us. On site, we also have a fitness center that we're going to be building out, and that'll be for patients and hopefully community members that feel comfortable enough to come in and just maybe get some movement in a space. There's also going to be kind of a supplemental healthy foods market
Wow.
on site that kind of will allow folks to hopefully get some fruits and some veggies in a convenient way, and maybe even supported by some of our programs, because food is medicine.
And it's that fresh food that's hard to get.
It can be, yeah.
Yeah. I'm sorry, you mentioned something earlier that I'm not familiar with. Walk with the doc?
Yeah, so it's, I actually don't know its origins, so you've got to forgive me, and kudos to whoever came up with it. But the idea is that you would, you would go on just walks, like, not even exercise, but just kind of getting yourself moving and getting out and getting going. And you would do that with a medical provider, and you would talk through public health issues or concerns that you may have about your community and its health and well-being. And it's just, so we're planning on doing that, but in my mind, I don't really know why you can't do that with a little trash picker and a trash bag. So our hope is that we're going to be able to maybe also pick up any refuse that we may pass on the way.
I know in our office we have a lot of walking meetings.
Oh, I'm sure.
We'll walk
Yeah.
around the block or,
Yeah.
down the street.
Yeah.
So walk and talk, yeah.
Yeah, so just get out and get moving a little.
That's exactly right. I love it. So the West, it is open,
It is open.
and lots more to come.
Mm-hmm.
But the other clinics are going strong.
They are. So those clinics are in Kanawha City, Riverside, Dawes, Sissonville, and I said Dawes, it's Cabin Creek, it's the original site, but Sissonville, Clendenin, Sunnyside Health Center, which is located inside the Kanawha Charleston Health Department, and now the Westside Health Center.
Okay, and then we mentioned it, but we didn't really talk much about the mobile clinic.
Yeah, so the mobile clinic is actually supported by you all, and very thankful for that. And so it rolled out in the mobile team went out in 2020 and really kind of started identifying pockets of individuals who kind of seek care atypically. And the goal is to just create an environment where they feel safe and comfortable in their health care in the community. And that really the lessons that we learned, we've always been very into person-centered care, but the lessons that we learned about delivering better person-centered care from that team and that work is really kind of what laid a lot of the foundational work for how we're approaching Westside Health. And so it's been very exciting to watch something that's really addressing a relatively small but high, really a group of folks that are often underserved, but see how the lessons learned from that have allowed us to build program sets that are treating metabolic disorders in churches and kind of developing much broader program to kind of meet people where they are and make sure that they're getting the health care that they want and feel comfortable with.
Right. I have seen the mobile clinic. It's pretty amazing.
It's pretty neat. It's 26 feet, 2 exam rooms, restroom, and it shows up to your front door.
Yeah. Who doesn't love that?
Yeah, right?
That's good. And I know some of the clinics have social media pages.
Yes.
So there's information out there that way. The website is always the best, of course. And again, that is cabincreekhealth.com,
Yep.
where you'll find phone numbers to the individual clinics, addresses, all that good stuff.
Yep.
And then they reach out to their preferred location.
Yep.
And
we'll take care of them.
and then the schools.
So school-based health systems are generally in the Sissonville area and largely in the eastern part of the county.
Yeah.
Yeah.
I just love it. You're making
Me
it
too.
easy for people to take care of
That's the hope.
themselves.
Yeah, as easy as possible.
Yeah, that's the best thing. Jake, thank you so much for being here
Thank you,
today.
Jane. It's always
I've
a
loved
pleasure.
learning about what you're doing in the community and how really you're making health care
Well,
available to everyone.
thanks for letting us tell somebody about it.
Yeah, thanks so much. Thank you guys for joining us. This has been Community Connections brought to you by the Greater Kanawha Valley Foundation. We'll see you next time.